Adenomyosis is a common condition that affects the uterus in women of reproductive age, where tissues normally that lines the inside of the uterus goes into the muscle wall. This often causes symptoms like heavy periods or painful periods, but many women do not know they'll have this. There's a recent research that raised the question of does adenomyosis on its own put a woman at a greater risk of serious pregnancy complications. So it's looking at pregnancy complications and possible adenomyosis. This research was a 12-year study in which researchers set out to answer that question. They looked at 200 pregnancies, carefully comparing data of women with confirmed endometriosis with high-level ultrasound, excluding other factors such as uterine conditions, polyps, fibroids prior to IVF, to women without adenomyosis. And their goal was to see if women having adenomyosis increase the risk of a group of complications related to poor placental function, which are the most serious health risks during pregnancy. These complications included preterm birth, babies who are too small for gestational age, high blood pressure like preeclampsia, cases in which the placenta separates early, that is, placental abruption, and excessive bleeding after birth. The results were clear. Women with adenomyosis had nearly triple the rate of placental complications, 27% compared to 11% in the control group. Even when taking into account differences like maternal age and use of aspirin, adenomyosis remained a strong independent risk factor for these outcomes. In particular, the study found a much higher risk of almost 6 times for hypertensive disorders in women with adenomyosis. Why is this important? First, because the diagnosis of adenomyosis was made on ultrasound and may start becoming an indicator for high-risk pregnancy. And thus, these women may benefit from closer frequent checkup, closer blood pressure monitorings, and early intervention to prevent any complications. For example, some studies suggest low-dose aspirin may be useful. Now, what are the strengths of this study? Careful consideration and a good exclusion criteria, expert ultrasound imaging, and real-world outcomes. One, again, it's a small study, but it gives an idea about how we can screen for adenomyosis, investigate much better, follow up women much better, and probably give a better chance of having a healthy pregnancy.